So I'm pleased to introduce our panelists this evening for this discussion. Dr. Heidi Prather is a board certified physician in physical medicine and rehabilitation and sports medicine, and a diplomat of the American Board of Lifestyle Medicine. She serves as the founder and medical director of the HSS Lifestyle Medicine Program. She has practiced non operative musculoskeletal medicine for nearly 3 decades and enjoys clinical work. She enjoys teaching and she enjoys research. She was frustrated with the healthcare system's limitations and healthcare provider collaboration, as well as patient access to services needed to improve their musculoskeletal health. And so Dr. Prather developed the HSS Lifestyle Medicine Program to enable a focus on whole person health. Practicing lifestyle medicine has given Dr. Prather hope and energy to be involved in healthcare, not sick care. Dr. Laura Jasphy, our other panelist, is a senior clinical social worker and health coach for the HSS Lifestyle Medicine Program. Years of observing unhealthy habits within the healthcare setting inspired her to pursue a doctorate in health education, giving her greater insights into challenges of behavior, as well as the skills to support it. She enjoys helping others to make and sustain lifestyle changes, improve their quality of life, and return to activities that bring them joy. Thank you both so much for joining us. Okay, so let's get started. Let's start with the basics. Dr. Prather, in what ways does lifestyle medicine change the way we talk about and view health, and how is receiving care different through this approach?
Right. So lifestyle medicine is one of the way an actual entity of a healthcare delivery mechanism. So regular conventional medicine, that's another, if you want to put a type on it, versus alternative care versus integrative care versus functional care, kind of put it in that context. So lifestyle medicine is another form of healthcare delivery. Conservative or care, we typically deliver, as well as surgical care, we deliver in the conventional way of medicine, which is someone comes to the healthcare system and typically we passively give them something to help with intervention in their ailment. Lifestyle medicine kind of flips. It's the use of evidence-based, so it's all evidence-based therapeutic approaches that include these 6 pillars, including whole food plant predominant eating, regular physical activity, managing stress, social relationships, restorative sleep, and avoiding risky substances such as tobacco and alcohol are the biggest ones we talk about because those are pervasive in our community. But the idea is that the patient receives education to enable them to be healthy versus passively receiving a an intervention. And so everything is goal directed by the patient, and the 6 pillars are intertwined with each other. So if you come to our program and you have a a goal of improving sleep and maybe improving nutrition, we talk about all 6 of the pillars and how they can help you towards those 2 goals. And everything is based in trying to reduce systemic inflammation, because when we are aberrant or have behaviors around each of these pillars that aren't healthy, what results is the common thing is systemic, meaning all over your body, type low grade inflammation. And so by improving our lifestyle within each of these pillars, we can reach goals.
Great. And how does the approach of lifestyle medicine tailor to the needs of the individual?
Right. So each program for every patient that we work with is different. Everybody, some people, their main goal is I want to lose weight. For some people, their main goal is I want my diabetes to improve and I want my knee to hurt less, because we try to connect the dots that if you have a knee arthritis problem and the swelling you have, and you have diabetes that's out of control, those two things are actually rooted in the same problem. So by working on reducing inflammation through those 6 pillars, you're actually helping your diabetes as well as improving your pain. And so that person's program may look very different. They might work with a dietitian, they may work with our group programming, they may work with Laura, who's our health coach in this program. And that would be their program, and they might be with us 8 weeks, they might be with us 10 weeks, they might be with us a month. Just depending on what their goal is and where they are at baseline. So it's completely individualized to each person. It's not that everybody goes through a program and gets exactly the same thing.
So it's not one size fits all. It's really
Absolutely.
individualized and so comprehensive for each person.
Right. It drives operations people around me a little crazy because it would be easier if you just put everybody through the same thing. But that's not the point, right? The point is you meet the person where they are, what their needs are, and then you try to surround them with a support system that enables them to change lifestyle behaviors to get to that goal. And again, everything we're using is evidence based. So it's not just the latest trend in this or the latest trend in that. I think Laura's going to speak to some of those things tonight about here's where the evidence is now around some of this. And it's that's super important because there's so much out there in the wellness industry now. And it's hard to know what to believe and not to believe. Who has the best picture on Instagram, can be compelling,
Right.
but understanding where it is in the real science and what's really been shown to help improve health is the what we stick to, and that's the guiding principle around how we try to deliver the care and the content we're delivering. So,
Yeah. So tonight's webinar is specific to two pillars of lifestyle medicine. That's what we're going to focusing on today: stress management and social connections. Social connection. Sorry. So let's start with stress management. Why is stress relevant? Is stress management? Why is stress in general relevant to our physical health? What's its connection? How are they associating with each other?
right. So, stress management is a really key component to improving our overall health. We know if we have chronic stress in our life, that it leads to impaired health in many, many areas, as well as increasing anxiety, depression, obesity, cardiovascular disease, irritable bowel syndrome, our immune system, and other associated poor health outcomes. So it's linked to all of these things. And it's linked to all these things because we have increased stress in our life. We have that increase in that systemic inflammation that then feeds these other disorders. We know that there's a mind body and cognitive behavioral therapies that are also associated with improvements in immune function, chronic pain, cardiovascular disease, and anxiety, depression. Um, but uh, Lifestyle approach to adapting, decreasing stress as a is a goal. Again, uses interventions that kind of are holistic around the whole approach. We also know stress and other maladaptive responses often have multi-directional effects, meaning it can affect you in multiple different ways. And again, on other lifestyle domains, including behavior, stress management, it's an important pillar. I'll get it out of lifestyle medicine care. So, really, big thing we talk about is when there's increased stress in your life, if you have a painful musculoskeletal condition, guess what? You got more pain too. And
Mhm.
guess what? When you got more pain, you move less. And guess what? When you move less, you have more pain and you feel stressed, you don't sleep well. If you don't sleep well, you don't get DNA repair at night, which makes that's important to get restorative sleep because that's where you get your cell repair. That's where you get intake of serotonin, which makes our muscles and our in being feel better, helps all made in our gut for not eating right. It's very circular. You can see how I'm going there. But stress for some folks can be one of the biggest struggles of all the pillars because it's pervasive and it's in different parts of your life. And maybe um, one of the health predictors that's not consistently addressed within our healthcare system. And I think that's because we have benefits in our health insurance that they're over here in our behavioral health. So just send them over there and that will do it. And we don't necessarily integrate it into whole care. I am by no means an expert like Laura is because she's studied this more, but I know where to start a conversation because I've asked for certain training and I know what to look for and I know basic things I can do to interact with people to get kind of to the heart of it. And I think that's an important part of lifestyle medicine is that any practitioner, whether it's the dietitian, whether it's the health coach, the physical therapist, our care coordinator, we all have to have this a little bit of extra training on how to interact with people to facilitate change and not be, downtrodden by it.
Well, you're really highlighting. Oh, sorry. Go ahead, Laura.
Mhm.
No, it's very true. And I think, one of the best things that a practitioner can do is actually listen to your client or patient, because very often they are eager to share that information with someone, but not everyone asks or allows the safe space or time for that
Mhm.
discussion.
Okay. Absolutely. And you're both highlighting of how this could become a vicious cycle that needs to be broken somewhere.
Mhm.
And that it sounds like this is what you do. You're trying to figure out where this needs to, you need to insert yourself so that there could be a different, healthier cycle.
Right.
Um, and speaking of cycles, let's talk about social connectivity. Is having a support system really important to my health?
Mhm. Absolutely. And I think people understand that better since the pandemic, and that we all experienced being alone or more isolated than we ever had been. And I think prior to the pandemic, I would go, "Oh yeah, of course this is important. It sounds good. Yeah, I mean, I get the data. I've got, the resources here where this is from." But having, gone through that experience and how we're still not as connected as we were previously, we're doing a lot more things on screens and not with, when I meet somebody, sometimes I go, "Oh, it's so good to see you in 3D," because I've seen people on a screen, but I haven't physically been with them to read their body language and that type of thing. So I think people are much more, uh, uh, seeing this as a priority than they probably ever had prior to the pandemic. So we know unhealthy social relationships, isolation, and loneliness are associated with increased mortality, meaning shorter lifespan, increased morbidity, and especially among individuals with established lifestyle related diseases, meaning diabetes, obesity, high blood pressure, high cholesterol, cardiovascular disease, and even some cancer. So if you're at risk already, with some of those diseases, having loneliness or having social isolation or having unhealthy relationships can actually progress your disease process more. So it's really something to pay attention. We know there are micro moments of human connectivity are correlated with a physiological response. And I always give this example. I'm from the Midwest. We're a very plain, stoic group of people. I thought I would really be run over by when I came to the great city of New York, right? But I love it here. I get on an elevator and I get off the elevator. I don't know who any of these people are, and they all say, "Have a good night." That's a micro moment of human connectivity that I had never experienced before. I love it. And now I say it. And when I say it, I have more gratitude. And guess what? My inflammatory marker probably goes down because things reflect off each other when we do that. So those micro moments of human connectivity are really important. And then a connection between a provider, coach, or health professional and the patient is really an active ingredient of lifestyle medicine. And we really strive for that in our group. Our program is primarily virtual. Just started some hybrid where we have some people in live in person and some people still virtual. I think that's probably where it's at because it's hard to get places. Um, but that you have to have that connectivity and, when I'm seeing a patient, I say, my job here is to enable you. My job here is not to do this to you or tell you what to do. I'm going to give you education, and then we've got to work together and figure out how do you implement that for your own lifestyle. So again, the social connection even of the provider to patients really important. And the social connections are really multidimensional relationships with other lifestyle behaviors, right? So if I have a lot of stress, you have to see how you interact with people with maybe different. Um, Making sure your social connections are supportive of your desire to improve your lifestyle behavior. So if your group always eats beer and pizza and they won't deviate from that when the social setting, it becomes hard to do that. I had a lady once that says, "Oh, I'm missing going out with my friends because they don't choose the right restaurants." I said, "Well, what restaurants are they choosing?" We got online, we got on the menu and said, "Those three things you can ask the chef to adapt, go. It's really important to go to lunch with your friends." And that's the kind of thing you got to do, like help with problem solving in the moment because there's so many barriers that are put up in our way for being healthy.
exactly.
More
And
than you
I'm
wanted, Linda.
But I'm always telling people, I do believe for most barriers, there are workarounds. I mean, some things in life you can't do anything about, you can't change. And it's good to recognize that so you don't waste your energy there. But there are many things that you can change, like picking, finding some healthier things on a menu so you can still go out with your friends or family. Making healthier choices is usually possible pretty much anywhere. And even if we're not talking about food, but just healthier actions, generally speaking, there are many things where perhaps you can't change whatever it is, but you can change your perspective. And so there are a lot of ways to feel empowered and to really forge, connections and to reduce stress. It just takes a little bit of effort, nothing like mindfulness, thinking about exactly what it is you're doing and problem solving, prioritizing. These are all really uh, important tools to navigate through life's ups and downs.
It's especially heartening to hear from both of you that, you don't really have to plan a whole party or a whole luncheon to have this social connectedness. You could have it in the elevator. You could have it with the grocery store clerk who's helping, put your groceries in. You could have it with going to lunch with your friends. So you could get, you could get this in different ways. And you're saying that that could positively add to your well-being.
Mhm.
Um, so, Laura, let's talk about stress management. There's a lot of focus on wellness, and we may often hear about the benefits of exercise, meditation, and the like. But where do we start?
Well, I think when we're talking about stress management, like I said before, one of the best things we can do for ourselves is think about prioritizing. And also, again, recognizing where we can make changes and where we cannot. So we only have, we have a limited amount of energy on any given day. Uh, if we spread ourselves too thin, uh, usually it doesn't end up, uh, in we don't end up with the best case scenario in any number of areas. So I think it's good to pick your battles, so to speak. Uh, Now, knowing with the whole wellness thing, that is the buzzword for so many websites these days, or whether it's programs, products, like Dr. Prather said, Instagram, TikTok. I think we're bombarded with things, and so it is, I think, sometimes difficult to really sift through all of that and know, well, what's reliable, and we like to work off of scientific evidence, right? But there are a lot of people out there that are really about marketing something, either themselves or a product, and you do need to be careful about your resources. So I did share some resources, which I know we'll share with our participants later, that I think can be very helpful, that are, legitimate. Usually, if you're looking at, for instance, a website, if you look at websites that are .edu education or .org, you're off to a good start, because these are usually educational institutions or government websites that are more reliable. And again, presenting information that's based on scientific evidence, as opposed to a .com, which is probably looking to sell you something. So that's probably the best advice that I could give in terms of being careful about resources.
These are great. And I remind the audience that we will send these out after the program. Um, we have some great slides that you put together that would you like to speak, walk us through that, specifically the stop technique?
Okay, so the stop technique. So I think a lot of people are familiar with the term fight or flight, which is the response of our autonomic nervous system, which kicks in either in a single stressful event or it can also occur when chronic stress is present. So, autonomic is kind of like automatic. I mean, it can occur really almost unconsciously that your system automatically does this, and it's a protective measure when we're faced with some sort of a stressor. But in between the space of the event that is the stressor and your reaction or response to it, there is a space, and that space usually is about your feelings in relation to the event. And if we just go on the feelings, usually if we react and it's more emotional, the odds are we may not be making the best choices or in terms of response because our emotions are typically heightened when we're feeling stressed. And so it's good to take a step back, and whether it's a virtual stop sign in your head or a mantra that you might say. I have one when something pops in, when I'm faced with a choice that I have to make quickly. I don't want to necessarily make it quickly, but I want to make a better choice for myself in terms of response. If I have some kind of a negative voice in my head or about to respond in a way that may not be the yes, I will say to myself, not helpful. That's my stop sign. But you can use whatever you want. Point is to really have that moment where you can think and come from a place where you're more mindful about your response. So you're not necessarily reacting as much as responding in a healthier way. So I hope that makes sense. But the stop sign is good because it gives us a moment to really take a breath. Breathing is always good. You don't do anything formal like box breathing. There are all kinds of breathing techniques out there, but honestly, just a nice inhale through the nose, exhale through the mouth. Do that a couple times, and it really can calm you down and gives you the ability to cope and to think. And just like a GPS, you can say rerouting. So shift directions and you'll be in a better place.
This is such a helpful tool, um, pertaining to what you talked about, just getting control, somehow getting control, the way one reacts, and visualizing. So
Yeah.
helpful. Um, can you discuss different approaches you might take for chronic and acute illness? For example, like should you approach a chronic condition such as rheumatoid arthritis differently than a joint replacement? And this could be for both of you.
I think I'll let Dr. Prager speak to that one. I mean, from my perspective, as a worker, for me, it's really just about how it plays out for someone in terms of emotionally or psychologically. So the end result may be the same, but Dr. Prater speak to the
Yeah.
distinct differences.
Yeah, I think we're on the same page. You need the same thing for both. It's that regardless of what that musculoskeletal diagnosis. I'm not sure if you're giving me those examples because there's heightened stress, anxiety, worry around an upcoming surgery, right? That's maybe different, kind of a spike in life. And but you also
Mhm.
know that on the other side of that, hopefully there's this linear progression into improvement and your life can kind of go back maybe to some sort of baseline where, you're managing everyday stresses, it is fine versus someone with rheumatoid arthritis, which is a chronic condition, which may be long term, like it's not an episode that you expect to end anytime soon. Management of that situation from managing stress and making sure your social supports need to be enduring, right? And making sure they're around you and surrounding you consistently. Not that you don't need that with joint replacement, but there's a heightened awareness of needing around the time of a surgical intervention. Um, but with a chronic illness, for sure, or chronic, I don't want to say illness, condition, for sure. And the other thing is just to put a plug in there again for inflammation is that, rheumatoid arthritis is an autoimmune disease, and lifestyle medicine approach is one of the best evidence based approaches to helping manage and autoimmune diseases like rheumatoid arthritis. So it's not just, I need those support systems. It's enveloping maybe all six of the pillars as an approach that can really help with that chronic condition.
Again, so hopeful that, you know, this is such a hopeful way of looking at illnesses.
But
Yeah, go ahead.
I'm sorry, I don't mean to interrupt you. You just met me. Yes, and taking control of it versus it controlling you. I
Mm,
always talk about, we're in the who's in the driver's seat of this thing? If it's a musculoskeletal condition, is it the bone? Is it the muscle? Is it the tendon? Is it the whatever? Is it nerve? Whoever's in the driver's seat guides the car. And my goal is to put the patient in the driver's seat of their chronic condition so that they start to drive the car in the direction they want it to go to. And they have control of how to respond to spikes and problems and that type of thing. And I think that's a major goal. And like you said, hope, and hope's pretty important, especially in our day to day,
right.
with dealing with just life and especially with a chronic this condition.
Well,
Absolutely. Go ahead, Laura.
it's sorry, it's funny to use you know, the the language of you're in the driver's seat because I tell that to all the patients that I work with in the lifestyle medicine program. My role as a health coach is like that's exactly what I say. I'm here to help you to figure out the steps it takes. How do you map out uh, where you want to go, right? You know where you want to go, but how do you get there? And just like when you you put in an address in a GPS, it will give you a few different options, maybe something with toll, avoid highways, whatever. And sometimes it's a little trial and error figuring out what works for you, what's comfortable for you. But it really is for someone to find that out for themselves. I mean, with support, of course, I think is helpful to really uh, empower someone to figure these things out and give them the tools for coping and navigating, making healthy behavior changes, which are not easy to make. We're all creatures of habit, so change is never easy. But I think that really being there together, supporting that person who wants to make the change is key.
Absolutely. It sounds like the patient walks in and becomes a partner in their own care,
Yeah.
with your guidance. And that is very empowering. So I'd like to know, can you tell me some examples of health promoting social activities that, somebody can do? Like how would this play into the other pillars of lifestyle medicine? And maybe, we have a slide that you sent us, slide number 9, that might you could illuminate while you're telling us that.
These are There are many things, depending on where you live, what's going on for you health wise, what's your socioeconomic standing, all of these things really can impact uh, our ability to connect with others. And so, I think, and especially I think as we get older, because think about where you make most of your friends as you're coming up in your years. You have is in places like school and work. But once you're out of those settings, it really does become challenging. And especially now in a post pandemic era, I mean, there are a lot of people that are still reluctant to go outside, or, maybe it's difficult for them to out very much. But I think that first of all, getting back to what Dr. Prather said about, really looking for those moments, there are connections that can be almost anywhere if you're open to them. So while all of those things can factor in terms of your ability to get around, your transportation, income, all of that. I do believe that there are opportunities for everyone to make connections. And it's, in fact, it's, uh, the study showed that it's important a variety of connections, that's important. And I think especially older too, important to make some younger connections because very often I hear from people that are octogenarians and upward, if they're having difficulty getting around, many of them might be in the same boat. Uh, so, again, having variety uh, in terms of, age or interests uh, is really important in social connections. But I think again, there are many places, community center, department for aging, usually less than this amount of uh, uh, organizations or agencies. Uh, there are uh, any number of groups available if you have a hobby you like. Maybe you're interested in knitting, or if for the more mobile pickleball is a thing these days. But there are a lot of opportunities out there. Uh, I think people that have faith are fortunate that way because they tend to have community in churches and synagogues. Not everybody's religious, so that doesn't fit for everyone. But for there are many of these religious organizations where they welcome you. You don't have to necessarily be religious, but it's a good place to find community. So I think there's no shortage of opportunity out there.
So, thank you very much. You know, this is so informative. I want to start taking audience questions, starting with where does one start to meet with professionals or practitioners to start seeking help in this area? And is it covered by insurance?
Yeah, so we enroll patients in our program on a daily basis, and we finally have it. We have a nice website now. You can find our phone number on it. It's HSS Lifestyle Medicine. If you Google that, it should pull up for you. Um, Insurance, you're right, tricky, right? Our healthcare system is to do things to you, and then that's how they get reimbursed. Making people healthy isn't, making people money. So you're right, it's a problem. But how we've worked it is, it's fee for service. So anything your insurance covers, we bill for. We've worked hard at workarounds for things they don't cover. Particularly, dietitian can be kind of expensive. So what we've done is gone to group programming. So I can have the dietitian can come on, and you're just build a regular office visit with me, and we do what we call a shared medical appointment. And we can do that in a group setting so that not only do you get your questions asked and you get some great content, but there's also everybody else on the screens trying to do the same thing you are. And so their question may be relative to you that you may not have. So that's a way we kind of work around things that the healthcare system may not reimburse through regular insurance.
Okay, so I think that answers one of the other questions is, meaning would you work together with a rheumatologist as well, or the other? You're saying you would, and with other specialists as well. Okay.
Absolutely. Absolutely. We work with endocrinologists in our group. There's some folks that are either for their diabetes is difficult to control, and then as they improve, they have to come off some of their medicines. We call it deprescribing. And then some folks are very interested in working with the weight loss medicines. We particularly Jumpstart in our program. It's actually a low number. Um, but we have those adjunct people that we work with. Oftentimes rheumatologists are referring patients to us, so we work with the rheumatologist.
Great. One of our audience members is saying that she's living with her mother. She's in her 60s, and she likes the idea of this stop method. But how can she remember to do it, to stop and ask with her many triggers that can understandably go on in a dynamic like that?
It comes down to being mindful. I mean, it really does take an effort because your autonomic system, your nervous system is what's happening. That's automatic. And so if you just go with that, very often we do run with our feelings and emotions instead of stopping. So it does require some practice to know when you've been triggered and then to have that stop sign go off, take a couple of deep breaths, and think about what it is that will really serve you better in terms of your response.
Now, while this isn't just a webinar about nutrition, we did get an important question. Where can someone find a nutritional resource? Where can someone find nutritional resources specific for conditions like CKD or SLE?
Mhm. Yeah, so the American Dietetic Association, I think, has find a dietitian near you website. Um, at HSS, we have dietitians employed that, especially that work with our lifestyle medicine program, and so some of the same principles of lifestyle medicine apply to both of those, particularly lupus, chronic kidney disease. Yeah, there's very specific things you got to watch for. I know you know that. But you're right. When you have two things going on at once, how do you balance that? And I think if you have somebody who has a little bit more of that advanced learning around systemic inflammation, it would serve you well.
Thank you. And on that note, I just want to share the number if anybody would like to call for an appointment or a consult. The number would be 917-260-3111. That's our HSS Connect hotline. And you will be helped, you will be matched with your insurance to these professionals. And we will put that in the chat box, and we'll also send it in our follow-up email. So in case you didn't get that, I'd also like to just talk about upcoming programs that some are related to this. Um, there's foot and ankle pain, regenerative medicine, some creative workshops such as Power of Music. It's a music therapist, it's an art therapist, and then of course our low impact exercise programs. Um, I would like to really thank Dr. Prather and Laura Jaspy for a fabulous talk, so informative, um, talking about a whole new aspect of a way to really deal with chronic and acute conditions. And and thank you very, very much. And we will send out these slides. We'll send out information how to follow up. And we would appreciate if you filled out our evaluation as well. Thank you so much for your time, both of you.